Good evening. Thank you for watching Dr. Make Me Beautiful. I'm your host, Andrea Housand, and I'm also the practice coordinator for Derek Jones Facial Plastic Surgery. And tonight we are talking about rhinoplasty. The nose, one of the prominent features of the face, plays a big role in self-esteem and appearance. And we have a special guest with us to talk about her past rhinoplasty experience, and we're happy she's here. Susan Ferguson, thank you for coming on with us.
You're welcome.
And my boss, Dr. Derek Jones.
It's good to be here.
It is good to be here.
Yeah,
This has been a
is.
long time coming.
It sure has.
How long has it been since your surgery?
Gosh, I think it's been almost 4 years now.
I think that's
Yeah,
about right.
Almost to the day.
That's right.
Yeah. So
Right.
very happy.
We have busy schedules, and Susan, you live in Navarre, but
Yep.
you work in
Destin. So
Destin.
yeah,
So
a lot
we
of
were-
travel time, but yeah, it worked out great.
So we were
for
able
us.
to make it work. And we just pulled up your op report just
Yeah,
to
went through everything, reviewed everything, so and it still looks great. I mean, that's the
it
thing.
looks great.
4 years later,
Yeah.
it's
It
fantastic.
does, but
I
we're
love
going to
it.
talk about the experience and have a little Q&A with Susan, and of course Dr. Jones's vast experience in ear, nose, and throat and facial plastic and reconstructive surgery. But before that, we're going to talk about our upcoming dates, where we're going to be around town.
We'll talk a little bit about that, just to show where we're going to be and how you can catch up with us over the next couple or 3 months. So save these dates, if you will. We're going to be out in Pace near the end of April, April 25th. Do injectable appointments out at Fringe Salon, and so we're always glad to go out and visit Pam and all our friends out there at Pace. Just give us, you can give them a call. That's their number, the 994-2104. You can always call our number, which is 484-FACE, 484-3223, to schedule an appointment. Get in touch with Andrea, and you can come see us in Pace. So if you live out that way, it's a good time to come see us. We are doing a seminar the very next night. We typically have a spring and fall seminar. This spring, we're going to have the seminar with Mark Lees, which we've had many times before. The other part of Dr. Make Me Beautiful, and he has his shows running opposite months. But Mark is going to do a presentation about skincare. We'll be talking about doing facial plastic surgery and injectables and things like that. We'll also have injectable appointments that evening. The seminar starts at 6:30. We'll start doing appointments for injections really about 5:30 or so. So get in touch with us if you want to come to the seminar, if you want to come have a filler or Botox or something like that night. And so you can call them, Mark's office, at 476-3509, or you can call us at 484-FACE, 484-3223 to schedule coming to the event. Just let us know. We like to have a head count of how many people are going to come. And then also, if you want an injectable appointment, come see us that night. We'll be in Chastain's the first week or second week in May 9th. Come see us at Chastain's Salon. That's on 12th Avenue in the heart of East Hill. Very convenient for people in the East Hill area, downtown, that kind of thing. Easy to get in and out, and that's one of the reasons we go to a lot of these places, is to make it easy for patients, and it's a little more convenient for everybody to do it that way. But we do dermal fillers, Botox, Dysport, those types of things. Their number is the 434-9935, 484-FACE. You can get in touch with Andrea, talk to her about scheduling an appointment there, and then tell her what you're interested in, and we can be ready to take care of you at Chastain's or one of the other places. And then we will be back out in Gulf Breeze at Jacobs Chiropractic on Wednesday, May 30th. Again, 8 to noon. We'll do injectable appointments. That's our number, the 484-FACE. Give us a call. We'll schedule you to come see us, talk about what you want to do, and we will be ready for that. We can do cosmetic consultations, dermal fillers, Botox, Dysport, all those types of things. Their number is the 916-7060, or again, 484-FACE to call us. And if you want to keep up with what we're doing, you can always catch us on Facebook on the Derek Jones Facial Plastic Surgery page. We always put what we're doing on there. Also put little things from our show and other little tidbits on the Derek Jones Facial Plastic Surgery page. Not so much it's going to overwhelm anybody, but that is a good way to keep up with us, because we always put any sort of specials, any sort of events, and all those sorts of things. It's a good way to keep up with us. Very convenient. You can also go to our website, which is drderekjones.com. So we're going to talk a little bit about rhinoplasty tonight.
I know. So back to us and back to Susan.
Exactly.
How long have you been considering having this procedure done?
Let's see. I think I started thinking about it when I was about 12.
Okay.
Yeah. And I remember very distinctly what happened. Somebody on my soccer team said, "Oh, you have the Hufnagel nose." I was done, because I was not. I always was a little self-conscious about it, and that kind of brought the realization home, I guess, that it was a little bit more prominent than I wanted it to be.
And I understand that too. And we're not going to talk about my nose tonight, but I had cosmetic rhinoplasty as well, and I had the Greek nose, and I had similar experiences. So I was 14 when I was like, this has got to go.
Yeah.
And thank you, Dr. Jones. Thank you.
My pleasure.
But,
we'll talk about that at a later date.
Another show. That's going to be another show.
That'll be another show.
But you did a lot of research to finally decide on Dr. Jones.
I actually I did research in Denver, and I also did some research on surgeons here. So I was born and raised in Denver. Around 2000-ish, I guess it was. I was doing a lot of research. I met with probably 3 different surgeons in Denver. It just didn't seem like a good fit for me during that time. So when I came down here, I guess I got a little bit more serious and interviewed some surgeons down here, and it was a really good fit for me with Dr. Jones. So I thought, this is the time and the place for sure.
Yeah, that's great.
Yeah.
And then you had a couple consultations with Dr.
I think we
Jones.
met more than once or twice at least, so which is good, which is fine. I tell patients, come back, we'll talk again. So.
No, it was the biggest probably driving force for me on my decision, because I really wanted to be comfortable with it. I had a lot of questions about anesthesia, the procedure itself, and really I wanted to feel comfortable with the personality of the surgeon. And I feel like your personality is just a really, for lack of better terms, kind of a soothing one. You answered all my questions. You gave me all the time that I needed. It was just, I had so much confidence rolling into that surgery. It wasn't even an issue for me at that point in time. So
I think it makes a big difference, and I really think it makes a big difference to feel comfortable with your surgeon. And my feeling is always, if people don't necessarily feel comfortable with me, that's fine. I mean, because I may not be for everybody.
Yeah.
But if the people that are comfortable with me, that works really well too.
Sure.
So, that I'd rather people go to who they feel comfortable with, whether it's me or not.
I'm in total agreement, because it's time consuming, and it also requires some follow up and things like that. And it has to be a good fit.
Yeah, it's a team effort. I mean, it's a team effort from our team in our office, and the patient, and the caregiver for the patient, and all those things work together to get a great result. And so we got to be on the same team from the outset. And it makes a big difference.
Total agreement.
Yeah.
So for folks watching the first time, could you elaborate on? We know your credentials and experience, could you elaborate on those for anyone watching for the first time?
Sure. Yeah. I mean, I did I went to undergrad and medical school, and then after that did a 6-year residency at University of Michigan, and did ear, nose, and throat, which facial plastic surgery is a big focus of that in our training. And then I also worked with Dr. Sam Lamont, who was a facial plastic surgeon in Pensacola for many years, and learned a lot about facial plastic surgery in general, and a lot about the nose specifically. And really the nose, and I say this all the time, that is the most difficult operation that we do. In facial plastic surgery. I mean, it is. Dr. Lamont, and I just saw him over the holidays. He's doing great. He said he used to like to say that's what separates the men from the boys, and that is, and I'd say the men and women from the girls and the boys, because it is a challenge, and there's a lot of fine anatomy, small differences are noticeable. Mm-hmm. It's right in the middle of the face, and it's also interrelated. So you make one change in one area, it can affect other areas. Mm-hmm. It's a challenge. And I take it very seriously. And I think any surgeon who doesn't probably is not as, may not want that person operating on your nose, because it is difficult, and you have to be very focused and very intentional and put a lot of effort. I put a lot of effort into every nose that I do. I mean, and it takes time, it's meticulous, so but the results are a lot of fun to see too. So yeah. It's like most things in life, what you put into it, you get out, and we put a lot of time and effort into it, and then the results, help somebody that has been thinking about having a nose job since they're 12 years old. So
well, and I want to add to that too, because I'm glad that you brought that up. One of the really important things that I thought of when I was making this decision is that you do surgeries from here.
Right.
And that's really important, because I didn't want to just go to a big plastic surgery group that does breast augmentations and rhinoplasties.
Right.
I wanted somebody very specific. And I remember this distinctly. It was the work that you did for reconstruction of cancer patients that really made me realize that you are kind of, the way that I thought of you and still think of you is that you're a person of medicine that happens to do reconstruction on the face. Right. It's a little bit different than a typical maybe plastic surgeon. Everybody has their preconceived notions about that.
Right.
And that's what really drew me over, was the work that you did on the reconstruction. It's got to be very difficult.
Yeah, it is. And that is. We're going to talk a little bit about that. We're going to have a great show on it, but we got to take a break, and we'll come back and show pictures and everything.
Stay tuned. We'll be back.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Your face is the first feature people see. Confidence in how your face looks is very important. When you want natural-looking improvement, choose a facial plastic surgeon who truly listens and understands your needs. Dr. Derek Jones, board-certified facial plastic surgeon, offers both surgical and non-surgical options to make you look and feel your very best. Call a facial specialist at 484-FACE or visit our website to learn more. Jones Facial Plastic Surgery, where science meets beauty.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Welcome back to Dr. Make Me Beautiful. In case you missed it, we are here with our special guest, Susan Ferguson, and Dr. Derek Jones, and we are talking about rhinoplasty. Hello,
right.
Welcome back. Before we went to the break, we were talking about the post-Mohs reconstructions you do on patients that have, say, lost their noses to cancer, and that was one of the deciding factors when you chose Dr. Jones, because he's not only a facial plastic surgeon, but he is
not just cosmetic, but we do
not just cosmetic,
a lot of reconstructive things as well,
exactly.
and really do a lot of surgery on the nose in particular. I mean, I do, sinus surgery. I'll do nasal reconstruction from skin cancer. We do rhinoplasties, functional nasal surgery for people who have trouble breathing through their nose, to straighten the septum, that kind of thing. So do a lot of nasal surgery. So anyone who's having a nasal problem, we can come see me, and we can look at it and see if it's a functional problem, it's a cosmetic problem, do all those sorts of things. So, I think there is a little bit of a difference when, talking about people who do, don't necessarily do a lot of functional nasal surgery.
Sure.
Yeah.
Yep. So how did you prepare for the big day?
Well, actually, everything kind of fell into place really well. I had a nurse at the place that I work. She was actually going on a cruise, and so we were going to have some flex time in where I was working, so I was able to take that time off.
That's good.
Yeah, and that made a big difference for me. As far as preparing for it, I just tried to get a good night's sleep. I was very conscious of kind of, eating well and all of that, and also preparing, the little things like, that you have to have smoothies and stuff. So getting the right stuff on board and things like that.
Making sure you got all your cold peas.
Yeah, because you don't want to
exactly
think about it later.
Right.
Exactly.
That's for sure.
Yeah, any tips you would give to anyone thinking about it?
It's been a while since I did it. One of the things that I do remember is I was actually doing the pain management. I just did it for about 24 hours.
Okay.
And that seemed to work really well, because after 24 hours, I didn't need any pain management medications at all. So I was very surprised about that, because I thought it would be a lot more painful than it was. So I was very pleasantly surprised.
That is true. I think I just tell people, the stuffiness will probably bother you more that first week than than pain. It's not very painful, but the nose swells a little bit. It's just stuffy the first week or so.
Yeah.
So that's but it's interesting to say that there's not a lot of pain associated, which is good.
I was really surprised about that. So it's good.
I want to show the pictures, because we have your before and after pictures, and I want to show what you used to look like, so they can see for themselves, where we came from and everything. And talk a little bit about what you didn't like about your nose before.
So I definitely didn't like how white it was between my eyes, like the bridge of my nose. I just didn't like that. I felt that it kind of hooked downward, I guess. On profile, when I smiled, it kind of drew down a little bit.
I'll show a couple other views.
Yeah, and I think on this view you can kind of tell you actually made kind of what my daughter calls the ski slope in the on the bridge of it.
Yeah, exactly.
And on profile, I think you can really tell the difference there. That I never liked my profile, and I think that this just really smoothed it out so much.
Yeah. I think it. I mean, one thing, I think it just fits your face so much better. I mean, and when you look at your nose and your chin and the lips and all that, I mean, that all looks like it fits like it's supposed to now.
And one of the things that I noticed is after I got it done, because I was very upfront with friends and family and things, so everybody knew I was doing it. One thing that I noticed is that people didn't necessarily say, "Oh, you got your nose done," but they would say things like, "God, you have really pretty eyes. I never noticed that before." So they were kind of. It wasn't that they were noticing the change in my nose; it was that they weren't noticing my nose. If that makes sense.
That I tell people almost all the time. My goal when I do nasal surgery, when I do a rhinoplasty, is to make the nose disappear.
Yeah.
Because nobody ever goes up to anyone and says, "Oh, you have a beautiful nose."
Exactly.
I mean, it's not supposed to be a feature that you really even see. If it's distracting from the eyes, that's the big problem.
Yep.
So you just make it fit the face, make it less obvious, and then people will focus on the eyes, which you oftentimes do. Like you said, people come up and they say, "Oh, you have really pretty eyes," or a beautiful smile. Those are the things that people notice on the face. And the nose, even though it's right in the middle of the face, it just should disappear.
Yep.
And if you make things look like they're supposed to, I have found that people don't really notice it that much.
That's right.
And it's funny that you say people really couldn't tell and that kind of thing, because I looked back through your op report. It's been 4 years ago. I looked back through it in preparing for the show and everything. We did a lot to your nose.
Yeah.
I mean, really a lot of fine work on the tip with really asymmetric type things, like doing a little bit of one thing to one side, one thing to the other, all those sorts of things.
Sure.
And that's what I really like about it, is that with everything that was done, it's still, people don't even really notice that we had it done.
Yeah,
it's
it was
crazy.
just such finite detail with it that it was an amazing and a really amazing job.
Yeah,
So-
yeah, it looks great, and it looks great 4 years later, which is
Yeah.
exciting too. I mean,
Yeah,
it just
it
has
sure
gotten
is.
better and better over time. It looks really good. And you are in healthcare. I
Yeah.
mean, you can tell people
Yep.
that, because that I think makes a little bit of a difference in terms of knowing,
Sure.
knowing what's what to a certain extent.
Yeah, so I'm a PA, and so I knew what I was getting into as far as the surgical process, anesthesia, all of that. And, those are, I think, really serious issues that, people need to take into account, that kind of cost-benefit analysis there. For me, it was definitely going to be worth it. And what I realized, I talked with a lot of my friends who were surgeons, anesthesiologists, and I personally got to the point where I felt very comfortable with the idea of an elective surgery. But I do know that those are the kinds of things that you have to think about with an elective surgery. I'm so happy I made the decision. I'm so happy I did that. My only regret is that I didn't do it 20 years earlier, but then I wouldn't have had you for my surgeon, so that wouldn't have been good either.
Yeah, right. It worked out. Yeah, it did
sure
work
did.
out. So it was really good. That's the thing. I mean, I find when they're ready to do it, they're ready to do it, and they're going to do it. And but yeah, I think doing the research, being prepared, that's an important part of it. So, but I do think that people who are in healthcare, who know, have some knowledge about it, it makes a difference. I think I always say, when nurses and other people in healthcare, say good things, that's very high praise, because they know who does what, and can sort of see behind the scenes a little bit.
Sure.
And so anyway, you knew what you're getting into, obviously.
Yeah.
And
Yep.
and that's good. So,
Yeah.
So you've been thinking about it since you were 12, so you had expectations. So everything he did met your expectations.
Yeah.
Yeah.
Yeah, actually exceeded
them.
Because one of the reasons that I was really thinking about it for a long time is I didn't want to be in a position where people looked at you and said, "Nah, she got a nose job." You know what I mean? So I didn't want that to happen. So, and that's, I think you and I talked about that a lot, that I didn't want that kind of, really pinched look and things like that. And my expectations have been exceeded for sure. So,
and that was, I think, a good thing about meeting like we did, was really coming together on expectations. I mean, and we had a pretty good understanding, I think, about what we were trying to do. I mean, we weren't trying to give you somebody else's nose or celebrity nose, but we were just trying to make your nose look the best for your face. And that's always the goal. I mean, because there are certain things about a nose that make it stick out. It's too broad, it's too big, it's, it sticks out too much. It's the tip of it is too high or too low or whatever. So those things can be corrected, but you can't make somebody's nose look like a movie star's. I mean, that's and so that's the kind of give and take we come to when we get together. So, but
Although I do think your nose makes you look like a movie star. Just saying, especially with the eyes.
There may be some movie stars that want your nose now. I
yeah,
don't know.
see?
It's a possibility.
I've had several people ask.
That's right. That's right.
Like, who are you?
That's right. Yeah.
Are you
really
famous?
Yeah, exactly.
So has your I know you were upfront with your family and friends, but they were supportive, I'm assuming. Or?
Oh yeah.
That's wonderful.
Oh yeah. I mean, I didn't I think part of it is when you come to terms with the idea that you're going to do this, it becomes more of it's not just an elective procedure. It's more like, well, I'm going to do this. There's going to be some changes, and I was very specific. I wanted this bump off my nose, and every member of my family knew how much I loved my prior nose. Let me tell you, 'cause they were so tired of hearing about it. So they were actually really relieved.
So
I had to finally get it done.
That sounds exactly like me. They're like, "Are you gonna do it or what?"
Let's get it done already. So,
But the worst is when someone says, "Oh no, I love your nose. That's who makes you you," and I'm like, "No."
Yeah. Nah, I didn't get a lot of that.
But I think we should show the photos again.
Yeah, we'll show. Yeah, go back to the. Well, I'll go back to the photos here, and let's show the photos one more time. There you go. I agree. I think it was a little too broad. The bridge of the nose or dorsum was a little bit too broad. The tip was a little bit wide as well, and that shows the better definition of the tip.
Definitely.
The bridge of the nose and the tip really fit together, and then again, just the profile brought your nose back to your face a little bit. Made it fit quite nicely, and it's pretty straight. But like you said, having just a very slight, it makes it a big difference. So it's feminizing, really.
We're running out of time, so call us at 484-FACE to schedule a consultation. And thank you so much for watching. Have a great night.